Have you ever noticed a loved one suddenly feel dizzy, confused, or unable to speak but then recover within minutes? Don't ignore it. It might not just be a moment, it could be a mini stroke, also known as a transient ischemic ataxia, and it's far more common in the elderly than most people think. According to the American Stroke Association, over 240,000 TA letters happen each year in the U.S., and nearly 1 in 5 people will suffer a major stroke within 90 days of a mini stroke. The symptoms may be brief, but the risks are long-lasting. That's why today's video, 8 signs of mild stroke in the elderly due to cerebral ischemia, is crucial for anyone who wants to protect their aging parents, grandparents, or themselves. Recognizing the early signs could be the key to saving a life and preventing a permanent disability. So if you care about your health or your loved ones, click like, share this video, and subscribe to our channel. Don't forget to turn on the bell icon so you never miss vital health updates. Let's dive in and uncover the signs you can't afford to ignore. Mini strokes, or transient ischemic attacks TIA letters, may seem harmless because their symptoms are temporary, often disappearing within minutes. But this brief duration can be dangerously misleading. A TIA is not just a minor health scare, it's a critical warning sign that a major stroke could be on the horizon. In fact, nearly 20% of individuals who experience a mini stroke will suffer a full-blown stroke within 90 days, according to the American Stroke Association. That's why experts emphasize that a mini stroke should always be treated as a medical emergency. And like major strokes, mini strokes don't usually leave permanent damage, which leads many people to ignore or dismiss the symptoms. However, the underlying cause, a temporary blockage of blood flow to the brain, indicates that your vascular system is already compromised, without timely diagnosis and intervention. The same conditions can trigger a much more severe and potentially disabling or fatal stroke. Adding to the danger is the fact that mini strokes are often misdiagnosed or go unnoticed entirely, especially in elderly patients. The symptoms may be subtle or mistaken for fatigue or aging. But early detection and proper treatment can drastically reduce the risk of future strokes. That's why awareness is not just helpful, it's life-saving. To understand the seriousness of a mini stroke, it's important to first recognize the 2 main types of strokes: ischemic stroke and hemorrhagic stroke. These 2 forms differ in cause, impact, and treatment, but both can be life-threatening. An ischemic stroke is the most common type, accounting for nearly 90% of all stroke cases. It occurs when a blood vessel supplying the brain becomes blocked by a blood clot or fatty deposit, restricting oxygen flow to brain cells. Without oxygen, these brain cells begin to die within minutes, potentially resulting in permanent damage, paralysis, or even death if not treated immediately. In contrast, a hemorrhagic stroke happens when a blood vessel in the brain ruptures, causing bleeding into or around the brain tissue, although less common. This type is especially dangerous because the buildup of blood can increase pressure in the skull and damage brain structures. Mini strokes, or transient ischemic attacks TIA letters, are technically a form of ischemic stroke, but the blockage is temporary, and symptoms usually resolve within minutes. Still, they serve as a red flag for possible future ischemic or even hemorrhagic strokes. That's why early recognition and prevention are absolutely essential for protecting long-term brain health. Here are 8 signs of a mild stroke that can be recognized every day. 1. One of the earliest and most common warning signs of a mini stroke, also known as a transient ischemic ataxia, is sudden dizziness or loss of balance. This symptom often occurs when there is reduced blood flow to the cerebellum, the part of the brain responsible for maintaining coordination and equilibrium. When oxygen and nutrients are briefly cut off from this area, it can result in vertigo, lightheadedness, or unsteady movements, even if no other symptoms are present. This type of dizziness is different from the kind you might feel after standing up too quickly or spinning around. Instead, it comes on suddenly, without a clear cause, and may be accompanied by a feeling of the room spinning, difficulty walking straight, or needing support to stay upright. In elderly individuals, this sign can often be mistaken for general weakness or aging, but it's critical not to ignore it. Because TIAs are temporary, these symptoms often disappear within minutes. However, they should never be brushed off. Sudden dizziness in seniors should be taken seriously, as it could signal a mini stroke and an increased risk of a more severe stroke in the near future. Prompt medical attention is essential. Another key warning sign of a mini stroke or transient ischemic attack TIA is the sudden onset of numbness, weakness, or drooping in the face, arm, or leg, typically affecting only one side of the body. This occurs when a temporary blockage reduces blood flow to the part of the brain responsible for controlling movement and sensation. When this area is deprived of oxygen, even for a few minutes, the body responds with visible changes such as a lopsided smile, a heavy or weak arm, or a leg that feels numb or difficult to move. Often, the person may not even notice these changes until someone else points them out. A telltale sign is when you ask the individual to smile, and one side of the face droops, or when they try to lift both arms, but one drifts downward involuntarily. These subtle but sudden signs should never be ignored. Although symptoms of a mini stroke usually resolve within minutes, they are a serious warning of a potential full-blown stroke. If you or a loved one experiences any of these signs, seek emergency medical help immediately. Early action can prevent permanent damage and even save a life. 3. One of the most alarming signs of a mini stroke transient ischemic attack is sudden difficulty with speaking or seeing. This includes slurred or garbled speech, known as dysarthria, where the person struggles to pronounce words clearly due to impaired control of the tongue, lips, or vocal cords. Another possibility is aphasia, a condition that disrupts the brain's ability to understand or produce language. Someone experiencing aphasia may say sentences that don't make sense, use incorrect words, or be unable to comprehend what others are saying even though they are fully conscious. Visual disturbances are also common. A person may experience blurred vision, double vision, or even temporary vision loss in one or both eyes. These symptoms occur when the areas of the brain responsible for language and visual processing are briefly deprived of oxygen due to reduced blood flow. Because these signs can appear suddenly and disappear within minutes, they're often mistaken for fatigue or confusion, but ignoring them can be dangerous. Even though the symptoms are temporary, they serve as a critical warning of an impending major stroke. If you or someone around you shows signs of slurred speech, confusion, or visual problems, seek emergency medical care immediately. Every minute counts. Another important but often overlooked sign of a mini stroke transient ischemic attack is a sudden inability to concentrate or focus. This occurs when the brain temporarily loses access to a sufficient supply of oxygen and nutrients due to a brief blockage in blood flow. Since the brain depends heavily on a constant stream of oxygen-rich blood to perform even basic cognitive tasks, any disruption, even for a few minutes, can cause noticeable mental fog or confusion. During a mini stroke, a person might suddenly feel mentally blank, unable to complete a thought, follow a conversation, or process simple information. Tasks that are usually easy, such as reading a sentence or recalling a name, may become unexpectedly difficult. In some cases, the person may feel overwhelmed, disoriented, or emotionally frustrated by their inability to think clearly. This lack of concentration isn't just a sign of tiredness or aging, it can be a critical early warning of a stroke. If these symptoms come on abruptly and are unlike anything experienced before, they should never be ignored. Timely recognition and medical attention are essential. The sooner a mini stroke is detected, the higher the chances of preventing a full-blown stroke in the future. 5. One of the most alarming signs of a mini stroke transient ischemic attack is sudden confusion or disorientation. This can manifest as difficulty recognizing familiar people, forgetting where you are, or losing track of time and date. For elderly individuals especially, this symptom may be mistaken for general forgetfulness or early signs of dementia, but in the context of a mini stroke, it requires immediate medical attention. During a mini stroke, reduced blood flow to areas of the brain responsible for memory and awareness can cause the mind to become foggy. A person may abruptly forget their name, the names of loved ones, or become unsure about what they were doing just moments before. They may also appear dazed, speak incoherently, or struggle to follow simple instructions. This type of mental confusion can escalate quickly if not addressed. While the effects of a mini stroke are often temporary, they serve as a critical warning sign of a possible major stroke in the near future. That's why recognizing sudden disorientation is so important. It's not just a moment of forgetfulness, it could be a life-saving clue. If someone experiences this, call emergency services immediately and seek professional evaluation. 6. A sudden and severe headache is another critical warning sign of a mini stroke, especially in elderly individuals. Unlike a typical migraine, which often builds gradually and may include visual auras or tingling sensations, a stroke-related headache usually comes on abruptly and with intense pain. It may feel like the worst headache the person has ever experienced and is often described as sharp, stabbing, or overwhelming. This kind of headache occurs because the brain is not receiving adequate blood flow, which leads to pressure and inflammation in certain regions. In some cases, it might be accompanied by other symptoms such as nausea, confusion, or sensitivity to light. And fortunately, many people mistake this warning sign for a regular headache or migraine and fail to seek timely medical attention. If you or a loved one experiences a sudden, unusual headache, especially if it lasts more than a few hours and doesn't respond to regular pain relief, it's essential to treat it as a medical emergency. Immediate evaluation by a healthcare professional is necessary to rule out a mini stroke and prevent the risk of a more severe stroke in the near future. Early intervention can make all the difference in outcomes. 7. Fainting, also known as syncope, is another alarming yet often overlooked sign of a mini stroke in elderly individuals. It involves a sudden and brief loss of consciousness caused by a temporary disruption of blood flow to the brain. This momentary lack of oxygen can occur when a mini stroke affects the areas of the brain responsible for alertness and consciousness. While the person may quickly regain awareness, the episode should never be ignored. And like fainting due to dehydration or low blood sugar, syncope caused by a mini stroke may be accompanied by other subtle symptoms like dizziness, weakness, confusion, or slurred speech before or after the episode. The person might collapse suddenly and feel disoriented upon waking up, often unsure of what just happened. In elderly patients, such fainting spells can easily be dismissed as a result of fatigue or age, but they may actually be an early warning of a more serious vascular problem in the brain. If you or someone you know experiences unexplained fainting, especially if it's a first-time event or paired with other stroke symptoms, seek medical attention immediately. Early diagnosis can prevent further complications and may even save a life. 8. Hallucinations can be a surprising but serious sign of a mini stroke transient ischemic attack, especially in elderly individuals. While most people associate hallucinations with psychiatric conditions, they can also occur when certain areas of the brain are briefly deprived of blood and oxygen due to a mini stroke. These hallucinations may involve seeing things that aren't there, hearing voices, or even sensing strange smells or movements. This symptom is often linked to damage or disruption in the brain's visual or sensory processing centers. For seniors, the experience can be deeply confusing and frightening. They may believe they're having a vivid dream or become unsure of what's real. Caregivers and family members might mistake these episodes for memory issues or dementia, when in fact, they could be early indicators of vascular problems in the brain. More importantly, hallucinations caused by mini strokes have been associated with an increased risk of vascular dementia, a type of cognitive decline caused by reduced blood flow to the brain over time. That's why it's crucial not to ignore this symptom. If a loved one suddenly starts experiencing hallucinations, especially alongside other signs like confusion or weakness, seek medical attention immediately. It could be a warning sign of something much more serious. Certain lifestyle habits significantly increase the risk of experiencing a mini stroke or transient ischemic ataxia, especially in the elderly. The first major factor is poor nutrition. Diets high in saturated fats, sodium, and processed sugars contribute to conditions like high blood pressure, obesity, and high cholesterol, all of which are direct risk factors for stroke. On the other hand, a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help protect vascular health and reduce inflammation in the body. The second contributing factor is physical inactivity. A sedentary lifestyle leads to poor circulation, increased body weight, and weakened cardiovascular health. Lack of regular movement can also worsen blood pressure and cholesterol levels. Incorporating even light physical activities, like walking or gentle stretching, can improve blood flow, heart health, and overall well-being, significantly lowering the risk of TIA. Lastly, chronic stress is a silent but powerful trigger. When stress goes unmanaged, it causes prolonged elevation in cortisol and adrenaline levels, raising blood pressure and damaging blood vessels over time. Mindfulness practices, relaxation techniques, and social support can be essential for emotional balance. By improving these three areas of diet, exercise, and stress management, seniors can greatly reduce their risk of mini strokes and protect their long-term brain and heart health. Recognizing a mini stroke or transient ischemic attack TIA quickly can be life-saving, and the FAST rule is a simple yet powerful tool to help detect early warning signs. F stands for face. Ask the person to smile. If one side of their face droops or looks uneven, it may be a sign of a stroke. Is for arms. Ask them to raise both arms. If one arm drifts downward or is weaker, that's another red flag. S refers to speech. Ask them to repeat a simple sentence. Slurred, jumbled, or strange speech patterns suggest a problem. Finally, T is for timed. If any of these signs are present, it's crucial to act fast and call emergency services immediately. Although symptoms of a mini stroke may disappear within minutes, the danger is far from over. A TIA is often a warning sign of a major stroke in the near future, sometimes within just 24 to 48 hours. That's why timely recognition and response are critical. Using the FAST rule not only helps protect the health of your loved ones but could also save their lives. If you or someone around you shows any of these signs, don't wait. Act fast and seek medical attention right away. Preventing a mini stroke or transient ischemic attack TIA is not only possible, it's essential for reducing the risk of a future major stroke, according to health experts. The best approach to prevention involves managing the key risk factors that often contribute to TIA in older adults. First and foremost, controlling high blood pressure is critical. Hypertension puts constant pressure on blood vessels, making them more prone to blockage or rupture. Regularly checking and treating blood pressure can significantly lower stroke risk. Secondly, it's important to manage cholesterol levels and blood sugar. High cholesterol can lead to plaque buildup in arteries, while uncontrolled diabetes damages blood vessels, both of which raise the risk of stroke. Quitting smoking, eating a balanced diet, and exercising regularly all help improve cardiovascular health and blood flow to the brain. Another useful strategy is the use of aspirin or blood-thinning medications, but only under medical supervision. Aspirin can help prevent clot formation but should never be used during an active stroke without guidance. In short, preventing TIA involves daily commitment to a healthier lifestyle. With proactive care and smart choices, seniors can protect their brain health and enjoy a safer, more independent life. The key takeaway from today's video is simple yet powerful. Mini strokes are warning signs, not harmless events. They may seem to pass quickly, but their consequences can be life-altering if ignored. By recognizing the early signs, understanding the types of stroke, and knowing how lifestyle choices like poor diet, lack of exercise, and unmanaged stress can raise your risk, you're already one step ahead in protecting yourself and your loved ones. Don't forget the FAST rule. It could save a life. Prevention is always better than cure, and with daily habits like controlling blood pressure, eating a balanced diet, staying active, and avoiding smoking, you can significantly reduce the chances of a TIA or major stroke. If you found this video helpful, please leave a comment below and tell us which warning sign surprised you the most, or share a tip you'll apply in your daily life. Your story might help someone else. And don't forget to like, share, and subscribe to our channel for more life-saving tips focused on senior health. Hit the notification bell so you never miss our next video. Stay informed, stay healthy, and we'll see you next time.